everyone. Good evening. Welcome to our 2018 Regional Community Health Awards. We are so glad to have each and every one of you here today. My name is Lakeisha Hammonds. I'm the Director of Community Health Services with Southeastern Health. And on behalf of our CEO, President and CEO, Ms. Joanne Anderson, I would like to send regrets from her. She had a conflict that came up today and she could not be with us. And just know that her heart is here with us at this awards event. Tonight's theme is Going the Extra Mile. And I think you're going to find, as you hear about each and every one of the 2018 nominees, that they have done indeed that. They have really gone above and beyond the call of duty and literally exemplified the theme and gone the extra mile. Tonight we celebrate the leaders of health and wellness in our region who have set examples towards improving the health of our community. And this is our 6th annual event. It's our 4th regional, but our 6th overall event, and we're very, very excited for that. I want to just stop right quick and ask, do we have any members in the audience that have been from our first 5 awards, any winners? Do we have any winners? If so, would you please stand so that we can recognize you at this time? That's right, Ms. Vanessa, you represent. Thank you so much. And we're going to take a look at some of those winners a little bit later on in the program as well. Tonight we're honoring 38 nominees and winners from 9 categories that are equally impressive as our winners and nominees. The categories in which we'll be recognizing are business, community education and emergency support, faith-based, government, healthcare provider, individual impact, in-house heroes, along with 2 distinguished awards, which are our Lifetime Achievement and Lifetime Commitment. We will also have special recognition of our Compassion for You Congregational Wellness Network, Covenant Churches and Partners. I want to orient you towards the program just a little. Your program booklet contains detailed information for the reason of the nomination. So these were the exact nominations that we received from the community. So your peers that nominated you, those are the nominations that we received. As the category is called, we will ask that the nominees from said category join us on the stage. As your name is called, we would ask that you please step forward as you are recognized. Then please step back in the line as the next nominee is called. In an effort to keep everyone in order, gentlemen, we know you're super, super nice, but we want to ask a favor of you tonight. It's okay not to let the ladies in front of you. So if you will please stay in the order that you are seated in, that's the way that you will be called. We would also like to ask all honorees and winners from each category to please report to the side entrance. So once you come across the stage, you're going to turn left. There will be someone who directs you. You're going to go left, you're going to go out the door and to the side to take a photo. After your photo is taken, please return back to the auditorium. But if you would like a copy of your photo, will you please let the photographer know as your picture is taken? I would like to just thank everyone who had a part in this program. There's so many individuals that it took to make this day possible, or this evening possible. And if I began to name names, I honestly would forget someone. So I'm not going to go into naming names for everyone, but just thank you so much to each and every one for the role or the multiple roles that you played in making this night possible. We greatly appreciate it. In addition, you'll also see recognition on the program. So thank you so much for that. But I honestly, especially with tonight's theme, would be remiss if there was not one individual that I did not really give some special recognition to, especially with our theme of going the extra mile. And to do that, I'm going to ask for the help of Mr. David Sumner, if he will please come join me at the podium. Mr. Sumner is our Vice President of Corporate Services and Chief Strategy Officer. And he's going to assist me with doing this presentation. And I'll be honest with you, this individual is the backbone of so many organizational events such as this. There's a lot of behind the scenes. You heard the Wizard of Oz, the man behind the curtain. Well, this individual is truly that. And I would like to ask for Mr. James Jones, and I know he's going to get me, if you would please come forward. As James is coming up, I want to just share with you, as you all know, those of you that know James just knows that he is all over the place helping with so many of our organizational events. And he doesn't take credit for anything. You would never know that he does all that he really does. And James, we honestly thank you for each and everything that you do to make all of our events successful. You truly don't get it. So this time, before we go into our entertainment, there was a young lady that worked with our Community Health Services Department, LaQuana Sinclair, and she passed away earlier this month. LaQuana was going to provide our entertainment, and we wanted to keep LaQuana as part of this program. So I would just like for everyone, if you would, to just have a quick moment of silence with me in remembrance of LaQuana Sinclair. Thank you. At this time, I would like to ask Angie Carter if she would come and provide our entertainment for us. Angie is going to sing Love Alone. time, we're going to segue into the award ceremony portion of our program. But remember at the beginning I asked if we had any previous winners in our audience. And I told you if we take a look at where they're at and what accomplishments some of them have made to date. I want to take a few minutes to recognize our previous 5 years of winners. And we want to share with you a video that has been put together to highlight that. And in addition, you'll see some of the individuals, kind of where are they now today.
full-time. I work at the New York Robeson office. I continue to do talks on the opioid crisis, which I feel passionate about, practicing medicine in Robeson County now for the last 20 years. In 2017, I actually was honored by being awarded the first DE Award, Provider of Excellence Award.
Since winning the 2014 Business Award, we have looked at serving additional children in backpack house. We started with 240, and now in 2018 we're serving 400 children. Backpack house is part of what we do in communities and schools across the county, sending home weekend backpacks for the children and holiday bags as well.
College has a feeding ministry, food pantry ministry. We give out bag lunches and they can get clothes. Since winning the 2017 Faith-Based Award, we have served through the feeding ministry over 17,000 plates, and we have given to individuals through the food pantry ministry close to 1,000 individuals.
Let's give them a hand. In previous years, as we have looked at our winners, we thought, oh wow, what wonderful work. But I will completely be honest with you. This group of 2018 nominees, you are in for a real treat. As I began to read and review the nominations initially, there were two things that came to mind. Wow was one of them. This is tough was the next thing. And ultimately, you know what I said? They're not gonna make this easy. And you all didn't. You really did not. I literally typed out what I was thinking as I began to read your nominations. And really, my thoughts were, you all really, truly exemplify and define going the extra mile. This was indeed a difficult slate of nominees, and each and every one of you have done a phenomenal job. Reading your nominations, honestly, again, absolutely floored me. And literally, when reading, I thought, yes, this is gonna be the winner. This is gonna be the one. And that was the constant pattern as I read and reviewed, and as the administrative team discussed, and we reviewed your nominations. It's beyond words, the work, and the remarkable work that you all have done. And we wholeheartedly say that in all sincerity. To the audience, family members, friends, and co-workers of the 2018 nominees, you all are in for a real treat to hear about the remarkable work that they have done. At this time, we're going to actually begin our program, and I'm going to ask the Director of Guest Services, Ms. Alicia Oxendine, and the Coordinator of Pastoral Care, Reverend Dean Carter, to present to you the 2018 Compassion for You Covenant Churches and Partners.
Good evening, everyone. As I say in church, I'll be better than that. I'm Reverend Dean Carter, Coordinator for the Department of Pastoral Care at Southeastern Health, and also the Coordinator for Compassion for You Congregational Wellness Network. Reading from the scriptures that I hold as my truth from Deuteronomy 30:19, it says, "This day I call the heavens and the earth as witnesses that I have set before you life and death, blessings and cursings. Now choose life, so that you and your children may live, and that you may love the Lord your God. Listen to his voice and hold fast to him. For the Lord is your life, and he will give you many years in the land he swore to give to your fathers, Abraham, Isaac, and Jacob." In recent years at these Southeastern Community Health Awards, We set a tradition by recognizing the inaugural churches who signed the covenant agreement for participation in Compassion for You, Congregational Wellness Network. Compassion for You is a pilot project to show the impact of faith health networking, the groundbreaking effort in trying to use faith tools to impact chronic disease conditions and social problems in a county that is listed at the bottom 10 in all of the United States in health and financial disparities. We are proud that this initiative is being adapted to the culture of Robeson County and the surrounding region, and is gaining state, national, and in one case, international attention in medical journals for our success. Our effort is focused on creating an epidemic of health by meshing faith tools and local resources with evidence-based wellness education and technique. Tonight, we begin the program by honoring the churches that have signed this covenant within the past year and have enjoyed the work of wellness with the covenant agencies of Compassion for You. The churches will receive a framed covenant for display in their respective houses of worship. The covenant is reflective of the commitment made by the church, the Compassion for You partner agencies, and Southeastern Health to make an impact on individual and corporate health by addressing wellness lifestyle changes. Tonight's inductees bring the network to a total of 21 churches. With the representatives from the churches we are recognizing tonight, please come to the stage to be recognized. While they are coming, it is asked that applause be held back until all four churches have been introduced and received their framed covenant. I will call for applause for all following the introductions. I'll ask that each honoree step forward as you are called. Our newest Compassion for You Congregational Wellness Network covenant churches are, in alphabetical order, first, Deeper Truth Deliverance Center from Fairmont. The pastor is Reverend Saikachi Scott. Pastor Scott is a devoted volunteer on the mother-baby floor at Southeastern Health. Her church has recently signed the CFU-CWN covenant and immediately hosted a CPR AED training event for her church members. Deeper Truth Deliverance Center is also issuing a call for this Faith Health Fellowship in the southern region of our county. Pastor Scott wants the church to be a beacon for all, especially in the Fairmont area. Our next inductee is Mill Branch Baptist Church, Fairmont. The pastor is Dr. J. Gentile Everett. Mill Branch Baptist Church has done an outstanding job of connecting faith and health on common core health concerns with the church family in Fairmont. It is a great example of small population churches doing great deeds of wellness impact on their surrounding community. They have already hosted an advanced directives event that was the largest of our church advanced directives events yet. And, and a church-wide Healthy Communities A to Z meal example featuring low sodium, low sugar, and gluten-free products in one meal. Biblical studies and perspectives regarding food were presented after this meal. That pastor brought a large contingent. I hate to tell you, but I did ask. It's your fault. The next church I'd like to recognize is Resurrection Church, Hope Mills. The pastor is Reverend Elijah Lovejoy, and Resurrection Church began the journey of seeking to be with compassion for you long before their covenant was signed. The employee standing before you is Debbie Phillips, and she inquired because the church was trying to become a center of health and wellness in the Hope Mills Graves Creek area. After the arrival of the anticipated pastor and the covenant agreement, the church set goals for their children's department to learn CPR and the use of an AED, inviting all church members and neighbors to come. They have also set into motion a church security committee, a rather elaborate committee, and have constructed a community playground where families are welcome. Pastor Lovejoy was also one of the first to reach out in the aftermath of Hurricane Florence as well. And lastly, we have the Life Center, St. Paul's. The pastor is Reverend Michael Gith. The Life Center hosted an advance directive presentation at the senior citizens meeting of St. Paul, inviting all area seniors to come and lunch and learn. And they have also sponsored the Bible study, How to Read the Bible for All It's Worth, asking for Compassion for You help in presenting the study. We will soon be working on a date for church-wide CPR AED training. The church was brought to our attention by a special friend, Dr. Eva Meekins, a church member as well as a part of another covenant agency partner, the Robeson Community College nursing program, and is a faithful member of the board at Southeastern Health. Would you join me in giving a round of applause to all the newest church staff members?
Good evening. I'm Alicia Oxendine, the Director of Gift Services, and it's a pleasure to be with you this evening. Our founding grant agreement stated that we would partner as an anchor hospital with a minimum of 2 local health care safety net agencies. To date, Compassion for You Congregational Wellness Network actually boasts of 17 covenant agencies working at various levels of community outreach to improve the health of our citizenry by teaching wellness lifestyle changes. We are using this forum tonight to recognize 3 of our newest agencies that have signed the display Covenant of Shared Commitments as covenant agency partners. Would all honorees come to the stage and be recognized in partnership? When I call your name, please step forward. Our newest Compassion for You Congregational Wellness Network covenant agency partners are, in alphabetical order, the first, Lumberton Christian Care Center of Lumberton. Christian Care Center is represented by board member Barbara Andrews, also my former elementary teacher. I had to throw that in there. The Lumberton Christian Care Center is a mission of local volunteers who give their time in Christian love to share with those in need. Since 1983, they have served midday meals from Monday through Friday, as well as serving men and women and families as an emergency shelter. Other churches, businesses, community organizations, and government agencies have also contributed to the success of this endeavor. In 1985, a larger location was secured, which would not only provide a hot meal, but also overnight lodging to people in need. Thus, the Lumberton Christian Care Center was opened in the annex of the Goodyear Hotel on 1st Street. As this building degraded, Lumberton Christian Care Center classes moved to a newly built construct on 2nd Street in 2015, adding classes for unemployment opportunities. Lumberton Christian Care Center has become the home of monthly health screenings offered by Community Health Services through the use of the Wellness on Wheels bus, as we know it, the WOW bus. Lumberton Christian Care Center has also fully trained their staff and board members in CPR and the use of an AED, which was brokered through CFU and the Southeastern Health instructor, Michael paid at cost and purchased through supporting church donations. North Carolina Medicist of Charlotte. Representing North Carolina Medicist is Misty Moore, Senior Development Director. North Carolina Medicist is a nonprofit pharmacy program providing access to life-saving prescription medications, patient support, advocacy, and related services for the poor, the vulnerable, and uninsured North Carolina residents. Since 1997, North Carolina Medicist has worked to ensure that no eligible person in North Carolina has to choose between purchasing food or their needed medication, improving the patient's health and lowering uncompensated healthcare costs for all stakeholders. Compassion for You has enjoyed 2 events with North Carolina Medicist by hosting 2 over-the-counter medication mobile pharmacy giveaways. Our first, held after Hurricane Matthew, set their event record, serving more than 1,740 local persons with $80 to $100 worth of medication and services. North Carolina Medicist. Second Harvest Food Bank of Fayetteville. Second Harvest Food Bank is represented by Ron Pringle, CEO. Second Harvest is part of the Feeding America network with over 200 food banks and 60,000 food pantries and meal programs. In a country that wastes billions of pounds of food each year, it's almost shocking that anyone in America would go hungry. Yet every day there are millions of children and adults who do not get the meals that they need to thrive. Feeding America Second Harvest works to secure nourishing food from farmers, manufacturers, and retailers to people in need. At the same time, we also seek to help the people we serve build a path to a brighter, healthier future. Second Harvest has already provided food and fresh produce for the caring and sharing holiday Christmas giveaways for seniors. The North Carolina Medicist event is currently working towards the idea of a clinic-based fresh fruit produce pharmacy project. I don't think they're with us, so we will get this to them. In closing, Southeastern Health is so very privileged to work in collaboration with such committed and gifted individuals across our service region to improve the health and well-being of our community. If we could give all of these recipients at this time a round of applause. Would you please welcome to the podium Ms. Lori Dove, Vice President and Chief Continuum of Care Officer of Southeastern Health, for the presentation of the Faith-Based Award.
Good evening. We've already heard some amazing stories, but get ready, we're going to hear a lot more. I would like to invite the nominees for the Faith-Based Award category to join me on the stage at this time. As I call your name, please step forward. First nominee is Chestnut Street United Methodist Church. If you will please step forward. Chestnut Street United Methodist Church hosted their second North Carolina Medicist over-the-counter medication giveaway event where more than 500 persons were assisted. The church also has consistently housed mission teams since the occurrence of Hurricane Matthew, providing volunteers with on-site sleeping quarters, meals, clothing, and laundry facilities to aid in the cleanup and construction activities. The church is also vital in the feeding of the disadvantaged through Hope's Table. Thank you. Calvin Gilmore helps the homeless individuals, people that are in recovery, and the general public by providing basic physical needs and spiritual guidance. His ministry educates and counsels on issues of substance abuse and is recognized for truly making a difference. Lumberton Christian Care Center. Lumberton Christian Care Center institutes a monthly health screen to include lifestyle tips and wellness education for the underprivileged and the homeless at their location. Lutherine McQuage. Lutherine McQuage is the leader of the health committee at Beauty Spot United Methodist Church. She is consistently striving to gear programs toward health for all of the church members. She has a passion and a desire for the community and its overall health. Prospect United Methodist Church. Prospect United Methodist Church has over 60 programs for the community, including Alcoholics Anonymous, Narcotics Anonymous, and feeding initiatives such as Backpack Buddies, Stop the Pain, a program focused on reducing the impact of substance use, is also housed at Prospect United Methodist Church. Their commitment to the community shines through their various programs that promote overall health. Thank you. Reverend Kenneth Spencer. Reverend Spencer volunteers at Gibson Cancer Center. He meets with our patients, he prays with our patients, and he prays for our patients. He supports them in any way that he can. He volunteers to help Gibson Cancer with the navigation program to make sure that our patients are fed during the holidays. He assists every year with our Survivor Day and with the Fall Bazaar. He is so important to our patients in providing spiritual support, love, and friendship. We truly don't know what we would do without Pastor Spencer. Tabernacle Baptist Church. Tabernacle Baptist Church provides outreach in the community through health screening to help with overall health, spiritual growth, and the well-being of people in the surrounding area. They also provide care packages to local residents of nursing homes and to those that are homebound. Thank you, sir. Trinity Episcopal Church influenced health determinants by starting the Lumberton Christian Care Center Soup Kitchen, which now stands independently on 2nd Street. They offer free community education such as CPR and Medicare classes. All right, y'all ready? The winner is Prospect United Methodist Church. I would now like to introduce to you Mr. David Summer. He is our Vice President, Corporate Services and Chief Strategy Officer, and he will be presenting the Business Award tonight.
Thank you so much, Lori. And I too am privileged to be standing before you tonight to share in the celebrations of the wonderful things that are happening in our community. Thanks to all of you. But I'd like to invite the nominees for the business category to join me on the stage. And please step forward when your name is called. The nominees for the business award are Biggs Park Mall for collaborating with Southeastern Health on health initiatives through continued support of Community Health Education Center and Community Health Services events. which include assisting with various health affairs, absorbing the cost of food for events, and encouraging other businesses to partner on major health observances. Thank you. Lumberton Bowling Center, for providing free bowling monthly to Southeastern Health's Privileges Plus group to encourage physical activity as part of a healthy lifestyle for older adults. Thank you. MG3 Farm. MG3 staff graciously hosted tour days for summer camps. They provided numerous fun and educational activities such as saponification and learning more about hydroponic farming. And I have to pause and tell you, for those of you that don't know, saponification is the art of making soap. So I didn't know that before earlier today. So Connie Ivy and Dustin Long with Robeson Community College. Our IT department from Southeastern Health and Robeson Community College partnered to overcome technical barriers so that our Harmony and EPIC courses could be conducted at the college by our IT training team. The community college team and staff were truly partners and shared the belief that the effectiveness of the training and teaching is closely tied to the environment in which we live. Their partnership was key to the organizational success and thus positively impacting the care of our community. Thank you. And now I have the privilege of opening the envelope. Maybe. And I'm proud to tell you the winner of the Business Award is MG3 Farm. Congratulations. I would now like to turn the podium back over to Lori Duff to present community education and emergency support. Lori?
All right, if the nominees for the Community Education and Emergency Support Award category will join me up here. Please step forward when I call your name. The nominees include Dr. Robin Cummings, University of North Carolina at Pembroke. UNCP faculty, staff, and students provide numerous hours of service to the medical community, addressing the determinants of health. These efforts are expected to increase with the addition of the College of Health Sciences, and we are really honored to have Dr. Jerry Beasley with us tonight representing UNCP. Thank you. The Expanded Food Nutrition Education Program Assistance, North Carolina Cooperative Extension, Robeson County Center, for teaching individuals to how to eat healthy on a budget and how to incorporate exercise in their everyday lifestyle. Ms. Janice Fields, she goes above and beyond to provide programming in the areas of food preparation, nutrition and wellness, and food safety and preservation to the citizens of Robeson County. Her Med Instead of Meds program teaches individuals how to make better choices. Emily Locklear, she goes above and beyond to promote domestic violence awareness in our community. She promotes the belief that everyone has the right to be free from abuse and that domestic violence is a family problem with a community solution. UNCP Healthy Start Corps reduces the number of infant deaths and low birth weight babies through the Healthy Start program, one-on-one case management services, and other initiatives. The Healthy Start grant allowed for a case manager to assess the needs of new mothers and link them to the services that they need. The UNCP Healthy Start team ensures that everyone, man and infant, gains access to and continued care within a comprehensive family-centered health delivery system. All right, and the winner of that is UNCP Healthy Start. I would now like to introduce Justin Bunn. He is the Vice President of Finance and our Chief Financial Officer to present the government award.
Thank you, Lori. Good evening. I would like to invite the nominees for government award category on the stage. Please step forward with your name. The nominees for the government award are Johnson Britt. While in office, Mr. Britt has worked closely with Southeastern Health on a number of initiatives, including sexual assault nurse examiners, trauma nurses talk tough, opioid preventative measures via the opioid roundtable, behavioral health issues, the adult drug court, and the Rising Point Child Advocacy for abused children, as well as assisting with the overall safety of Southeastern Regional Medical Center. He continues to be a champion for a safe and healthy community. Thank you. The City of Lumberton. The city went through great lengths to bring the Dixie Youth Baseball National Tournament to this community. The event shows the city's dedication to health by promoting youth involved in outdoor sports and doing something other than playing football. And finally, the Lumbee Tribe of North Carolina. By actively engaging with local health experts, the tribe has facilitated important dialogues aimed at producing meaningful results. Last month, the Lumbee Tribe announced a new opioid recovery assistance program, and is aware that the best way to improve the overall health of our communities is to start with our youth. Through the Catch Kids Club program, members of the Boys and Girls Club will be taught fundamental skills on how to achieve healthier lifestyles, such as eating nutritious meals and staying active. The winner is the Lumbee Tribe of North Carolina. I would now like to introduce Dr. Joseph Roberts, Vice President of Medical Affairs, to present the Healthcare Provider Award.
Thank you, Justin. I'd like to invite the nominees for the Healthcare Provider Award category to join me on the stage. And Robert Peace, I'm so jealous that you won this. I've never had a chance. Never. So please step forward when your name is called. And the nominees for the Healthcare Provider Award are Mr. Howard Brooks. He exemplifies patience and kindness while being a health professional and a student businessman. His company, Healthkeepers, is a Medicare-certified home health agency which provides hospice care, community alternatives, and case management programs, as well as home medical equipment and supplies. Next, we have ECU School of Dental Medicine. The mission of the ECU School of Dental Medicine is to both improve access to care for underserved populations by providing care and increased benefits working for these communities. Next, we have Robeson Healthcare Corporation. Robeson Healthcare Corporation provides an array of healthcare services at low or no cost to program participants. And last but not least, we have Robeson Healthcare Corporation again, their Healthy Start program. Robeson Healthcare's Healthy Start program provides leadership and advocacy by assisting families to become more self-sufficient, resilient, and healthy. This effort leads to the way in reducing infant mortality and perinatal disparities, improving birth outcomes, and improves the well-being of the family unit. And the winner is the ECU School of Dental Medicine. I would like now to ask Lakeisha Hammonds to return to the stage to present the Individual Impact Award.
So this is a large category, so we want to make sure that we have everyone in line as they come. So with the nominees from the Individual Impact category, please join me on stage. As your name is called, I would ask that you please step forward. The first individual in the Individual Impact category is Ms. Sheila Burke, and I understand that she could not be with us tonight. She is recognized for her contribution towards the better health of the community. Ms. Burke has worked on and off throughout Robeson County in the field of mental health since 1991. Most importantly, she is an advocate for members of recovery, partnering with local mental health agencies, educating individuals on local resources to include providing transportation to local support groups and events. Mr. Sam Davis. Mr. Davis has devoted much of his time to working with middle and high school age girls in perfecting their basketball skills. Every summer he hosts a free basketball camp for children in our community. The Junior Master Gardeners 4-H Club. Recognized for their partnership with the Southeastern Health Hospice House, they provide a peaceful environment for families, friends, and visitors. The Junior Master Gardeners of Robeson County 4-H impact the lives of these family members by providing comfort through lovely blooms and fresh produce. This next group, they're representative of the Lumberton Christian Care Center, and it's actually a group of 4 individuals who were nominated. They are Mr. Eddie Davis, Mr. Leroy Dixon, Mr. Henry McLaughlin, and Ms. Clementine Thompson McCormick. Please step forward. They are nominated as all 4 staff members volunteered with the center before becoming staff and continue to volunteer day and or evening hours in addition to performing their staff duties. This powerful indication of their dedication, compassion, and heartfelt desire to assist our family and friends in need. Ms. Linda Rice. Ms. Rice is a cancer survivor who volunteers much of her time at Gibson Cancer Center and is always eager to assist with community programs and Southeastern Health awareness initiatives. Mr. William Bill Smith. He is nominated as he believes in the community-based participatory approach and has represented rural communities and state health policies in organizations such as the North Carolina Public Health Association. Reverend Kenneth Spencer. Nominated as he volunteers at the Gibson Cancer Center daily, offering patient prayers of encouragement and conducting memorial services at their request. Reverend Spencer has donated clothing, food, and transportation for our patients in need. And lastly, Mr. Ernest Watts, who could also not be with us tonight, was nominated for positively impacting thousands of individuals throughout tobacco education. And the winner for the individual impact category is Lumberton Christian Care Center, Ms. Clementine Thompson-Cornett. He's the Vice President of Talent and Culture to present our In-House Heroes Award.
Good evening. At this time, I'd like to invite the nominees to please come forward. Our first nominee is Connie Britt. Connie, will you please step forward? Connie's morale and optimism, combined with her experience, makes her a great leader and a team player. She has excellent problem-solving skills and communicates effectively. Her ultimate goal is simple: better health. Thank you. Our next nominee is Joe Berg. Mr. Joseph Berg has made significant contributions to the betterment of the youth of our community by starting a venturing scouting crew which introduces and helps prepare youth for the possible career in healthcare. He is also on the Cape Fear Boy Scout Council Board. He is an Eagle Scout as well as a member of the Order of the Arrow. Thank you, sir. Our next nominee is Reverend Dean Carter. Reverend Carter has worked tirelessly in providing a volunteer ride program for our most vulnerable population. The ride takes them to physician and treatment appointments. He has also worked to coordinate and facilitate through churches, community volunteers, and the North Carolina Med Assist to conduct a free over-the-counter medication giveaway. He's expanded Southeastern Health's outreach efforts through the creation of the Compassion for You Congressional Wellness Network for the purpose of improving community health outcomes through partnerships with the faith community in collaboration with local, regional, and state agency partners. Thank you, Reverend Father. Catherine Gaines. I don't think Kat is here tonight, but I will read her nomination. Kat's overwhelming passion is shown every day through her ability to thoroughly listen to her patients, as well as her willingness to accompany them on every step of their journey. Consistently exhibits excellence and compassion in providing care by going beyond her professional role to make a difference in the lives of the cancer patients and their families, in the form of art therapy, financial navigation, women's health, clinical navigation, diabetes care, and the development of the local genetic testing. Our next nominee is Kathy Hunt. Kathy is a pillar in our community. She goes above and beyond to create initiatives to improve population health in our area. Thank you, Kathy. Mike Pate. Mike teaches the American Red Cross Heart Saver course in church and community settings. Mr. Pate has made himself available to Compassion for You Network, and he organizes those events and attends them in his off hours. Thank you. Our last, and by no means the least, is Carlotta Winston. Carlotta is nominated today for her willingness to assist in the community, whether it is in the distribution of meals for the elderly or supporting our Gibson Cancer Center's events and awareness initiatives. And the winner of the In-House Heroes Awards is Reverend Dean Carter. At this time, I'd like to ask Laura Dove to please return to the podium.
At this time, we are going to talk about an individual and award our Lifetime Achievement Award. This individual has been a pillar of our community. And I want to introduce to you District Attorney Johnson Brigg. If you will please join us on the stage. Johnson Brigg graduated from Wake Forest University in 1982 with a BA in politics and received his JD from Campbell University School of Law in 1987. He was admitted to the North Carolina State Bar in 1987 and the United States Supreme Court Bar in 1992. Johnson started his legal career in 1987 as an associate with Lee & Lee Attorneys at law in his hometown of Lumberton, North Carolina. In January of 1989, Johnson accepted a position as an assistant district attorney in the Robeson District Attorney's Office, Prosecutorial District 16U, and he served in that capacity until 1993. He then accepted a position as an assistant district attorney in the District Attorney's Office for the 13th Prosecutorial District comprised of Lake, Columbus, and Brunswick In 1994, he was elected Robeson County District Attorney and was appointed by Governor Jim Hunt to fill the unexpired term of his predecessor in December 1994. In January of 1995, Johnson Britt was sworn in as District Attorney for his first term in office. He announced his intent to not run for another term last year. As District Attorney, Johnson Britt has served on the following boards, committees, and commissions: North Carolina Conference of District Attorneys, the Executive Committee member, 1997, 1998, and 2000. He was the Vice President from 2000 to 2001, the President-elect from 2001 to 2002, and the President from 2002 through 2003. North Carolina Criminal Justice Education and Training Standards Commission, he was the Commissioner from 2007 to 2012. North Carolina Innocence Inquiry Commission, Commissioner, District Attorney member, 2015 to the present. In 1997, Johnson Britt participated in promoting innovation in prosecution. Sponsored by the Jefferson Institute for Justice Studies, Washington, D.C., and in 1999, he was a featured speaker for the National Association of Prosecutor Coordinators, as well as the New York Prosecutors Training Institute. Management Seminar for Upper Level Supervisors. He has served on North Carolina Seminar for He has served on the North Carolina Advisory Committee. He fights crime, invests in kids since 1997, and he serves on the Robeson County Juvenile Crime Prevention Council. He and his wife, Fordham, live in Lumberton and are the parents of 3 children. He attends First Presbyterian Church of Lumberton, where he has served as a deacon and an elder. And I just have to tell you that we are very blessed and honored to have Johnson Britt have served our community for all of these years, and we are going to miss him. Thank you, sir.
I want to thank Southeastern Health. This was a surprise, an honor. I want to thank my wife for her love and support over all these years. She is in attendance. My daughter and son-in-law were with her. When I was first elected district attorney, my goal was to change the criminal justice system in this county. And I hope over the course of the last 24 years, I've been able to achieve that. It became evident during the course of my career that I had to change different ways that we addressed crime in this county. And the biggest area was how do we identify who drug users are, how do we identify who drug dealers are, because you deal with them in several ways. Drug users, you want to give them the opportunity to go into rehab, beat their addiction, and go on to live purposeful lives. Drug dealers, you want to punish them for the damage that they do to our community. Over the course of that time, Judge Carmichael, who was featured earlier, he and I have worked tirelessly to try to develop a criminal drug court, adult drug court in this county. We have been unsuccessful in that because we can't find money. We partnered most recently with the hospital. It takes service providers, which the hospital is willing to do, to give us. But it also takes money from various organizations that we just could not scratch the surface with. And that's an area where I'm sorry I haven't been successful. But hopefully we've laid the groundwork for the future development of that court and to the benefit of this community. Again, I'm astonished by receiving this award. A lot of people look at me and say, oh, you just send people
Commitment Award. This is a gentleman that you all know and have seen many times. He has been on the front lines of fighting for better health and a better Robeson County. So at this time, I would like to ask Director of Public Health, William J. Smith, to join me. As Bill is coming up here, as most of us know him, just want to talk a little bit about what he's done. Robeson's top 10 leading causes of death are defined in the 2015 county health assessments include diseases of the heart, cancer for all sites, Alzheimer's disease, chronic lower respiratory diseases, diabetes, cerebral vascular disease, motor vehicle injuries, and all other unintentional injuries, assault and homicides. And Robeson County Health Rankings by Robert Wood Johnson Foundation is 100 out of 100. We have a long way to go. But I can tell you that there is no individual that works harder and is more troubled about the health statistics in our county than Bill Smith. Some of the most persistent factors that are linked to ingrained cultural issues, as well as the county's lack of economic availability. Young people in Robeson experience a death rate 60% higher than the state average, and the overall homicide rate is more than triple of the state average. These statistics should alarm all of us. We should all be trying to do something to improve, but no one focuses more on these issues than Bill Smith, the Director of Public Health for Robeson County. For decades, he has led numerous initiatives to help address each of these and other issues as well. Through his leadership, the Robeson County Health Department has tackled teen pregnancy, motor vehicle accidents, low birth weight, substance use and abuse, obesity, heart disease, and stroke. Some of the recent initiatives under his watchful eye include Faithful Families Eating Smart community classes, raising awareness of the state health plan coverage for diabetes prevention, checking, changing, controlling hypertension self-monitoring program, collaborative efforts with entities across this county for specific initiatives. He and his team has served as great partners for Southeastern Health. And I know in my role, there are many times that I've called Bill and said, I need your help. I need you to help me come alongside and help us do this. And he is always willing, always there to help lend a hand to better our community. I could go on for hours, but let me suffice it to say that Bill Smith, through his leadership, has changed the face and the culture of Robeson County. Thank you, sir.
Thank you. You want to get in the Rock and Roll Hall of Fame while you're still alive, so thank you. she left off mosquito spray. That's what we did last. So. I'd like to acknowledge Melissa Packer, who's been with me almost all 30 years that I've been here. And I think the effort that I'm most proud of is one of the previous winners, the ECU Learning Center. We were not the top pick. I mean, that took a lot of work, and I appreciate them going out on a limb to come here. It's doing exactly what we wanted. It's creating more dentists for the area. It's our kids wanting to be dentists. I mean, it's perfect. So it's everything that I wanted it to be. And I thank Southeastern for acknowledging me.
Tonight's program, I think you will agree with me that we have met a lot of people who have gone the extra mile this year to really change what we see in our community and how we live in our community. And it's changed for all of us. It's not just one individual group. It's all of us that live here, work here, and have families and know that we can move forward with lots of hope and lots of partners. This is just tip of the iceberg of what our community is able to do when we come together and look at each other as people and not as if different communities. We look at each other as one. So I really want to thank you all for coming out and going the extra mile. All of the winners, we would like to invite you back on stage to get a photo and to make sure that we have everybody recorded in our album for next year. I'm sorry, to the photo area, not on stage. We'd like you to return to the photo area. So thank you all for coming out tonight. It is a pleasure to have this award ceremony. Have a blessed night.